with Chloe Tilley and Callum MacDonald.
Good morning. Thank you for being with us on this Sunday morning. So, record accident and emergency waiting times, a growing backlog of cancer patients, a historic nurses' strike looming, a shortage of medical staff, an ageing population, inflation, funding gaps. Well, the challenges just go on that are facing the NHS. They are plentiful and many just come down to money. Well, the Chancellor warns in today's Sunday Times that very horrible decisions will have to be made in order to protect the National Health Service, prompting the question, can we still afford our NHS? Well, let's discuss that with Professor Nora Colton, who is Director of the world's first business school for health at University College London. Morning.
Good morning.
Thank you for being with us. And also with us is Dr. Tony O'Sullivan, who is the co-chair of Keep Our NHS Public. He's also a retired consultant paediatrician. Good morning.
Good morning, Chloe.
Thank you both for joining us. Let's begin with that first question. When we look at the state of the NHS at the moment and the current state of the economy, can we still afford our NHS? Professor Colton.
Well, I think, we have to have a health service, and we need to understand that the current system, which is very much based on our hospitals, is not working. So if we want to transform or change that system, then we have to understand that will cause investments and more expenses in the short run. So what are some of those choices that we have? Well, we're introducing integrated care services. We hear a lot about preventative care, moving things out. We see our hospitals have a problem both at the front door and the back door. People are GPs can't cope with the load. So people come to our hospitals. Then we have people staying long in hospitals because they can't get out the back door because our community services are not where they are. So I think we understand the problems. It's how we want to then pay for that. And I think that, there's lots of choices. There's different models. Of course, we use taxation. We've got in a position where most of our NHS is funded through our general taxation and just supplemented by our national insurance contribution. This, of course, makes our health system very vulnerable then to politics and to the state of the economy. So as we spend more on healthcare, and we need to spend more, we have an aging population. We have lots of people with various non-contagious, non-communicable diseases that need to be treated. So that creates a lot of tension. You're going to have that rising cost. Your health services are going to consume more, increasing proportion of your public spending. So you either have to raise taxes or you have to figure out what you're not going to spend on. I think we spend too much time talking about cost containment, even within the NHS, when we are very underinvested. We need capital investment. We need our workforce in the right place to be funded. If we're going to have more community services, we need more community health nurses, and that is actually decreasing. So I think that we need to take a hard look at the system. Of course, we've got to have a very good health system. It's the backbone of the productivity and well-being of our population.
Yeah, well, let's look at some of the issues you raised there, Professor Colton, because it is very interesting. And Dr. O'Sullivan, I'll bring you in on this. The issue about political interference is one. Gordon in Edinburgh has got in touch saying it's time to move the NHS to a wholly owned national trust, something that has no political interference long term. Planning and investment can be generated without the push-pull of political cycles. Do you think that would help? So there could be some long-term planning?
There is no way that a health service can be run for the population of 65 million without political handle on it. The question really is what belief system, what ideology is going to be supporting the kind of health service that we have. My question really is, can we afford a government that doesn't believe in the National Health Service as a publicly funded, publicly provided service? I think we can afford the NHS. All the description of the current real disaster that we're facing, that you, Chloe, have said, and that Nora Colton has added to, they are symptoms of what's been allowed to happen, especially over the last 12 and a half years. And if we're looking at the evidence for how the NHS can be run, then when the NHS was funded properly, so that there were enough staff in place, there were enough hospital beds in hospitals, GPs were better funded than they are now. GP funding has gone down over the last few years, not up. Then the NHS was considered serially by international comparisons as not only the most democratically accessible health service for the entire population, but also the most cost effective. And when you compare the question of can we afford it, you have to have international comparisons. And when the health service has been funded properly so that it was functioning well, and it was functioning well, we have to remember this. We have to have some memory that in 2010, people were seen within 18 weeks and treated for their complaints. They were seen within 4 hours in A&E, and GPs were relatively much better supported than they are now.
So are you saying it's simply about money? Pump more money in and it will work?
Well, I'm not so simplistic as to say only money matters, but I am saying that the 12 and a half years of serial underfunding of the NHS compared to need has ground a highly respected, internationally renowned service into the ground with staff deeply lacking in morale and leaving the service in droves.
The problem
is that's a national crisis that we really have to address. And it's wrong to say introduce a new system when the system that was supported properly was working very well.
The problem here, Professor Colton, is money, isn't it, at the end of the day? And, raising taxes already, in the economic environment in which we're in, raising taxes for more money to go into the NHS. I mean, that's just not politically palatable.
Yes, and I think that's the dilemma, right? Politicians are reluctant in such an environment to raise taxes. I think, though, that we could earmark taxes, and there are other models, and we talk about efficiency. Well, of course, the most efficient thing would be just to not provide anything. So we need to be careful about how we use that word efficiency. I think, we have to have a good level of care. We have to be able to provide quality care for people.
It's interesting. Forgive me for jumping in, Professor Colton. I'm really interested to get Dr. O'Sullivan's view on that. So it's about don't maybe care for as many different areas, maybe cut down on the areas, which you just suggesting there. I mean, Tony O'Sullivan, when the NHS was founded in 1940, I mean, it was actually thought that there would be less need for it as people's health improved. But people are now living longer. And just because people can live longer, do we need to have a difficult conversation about treating people according to their quality of life rather than just treating people because we can keep people alive, we should keep people alive? Is that a difficult conversation we need to have?
I don't think we need to have that at all. I mean, the question about good palliative end-of-life care is a whole other issue, and the quality of our service in this country is disgraceful, really. And we saw that more than ever during the COVID pandemic, which is, of course, still with us. But could I just say that when we're talking about money, it's also about how we use the money. And one stark fact at the moment is in the last year, the government has spent £11 billion on agencies providing staff to fill the workforce gaps on shifts in hospitals and in primary care. £11 billion, and yet they're refusing to give a reasonable pay rise to NHS staff to allow them to be able to feed themselves and their families and to want to continue to work for the NHS. So that's one example of how
it's about using the money that they've got better, and this is something we talked about on the programme yesterday. I mean, reports up to £2,500 for a shift. Very briefly, because we do have to move on, but briefly.
Well, just two other examples. The government decided, the government found in the pandemic that the NHS had been, that they'd underfunded it and left it run down. They've now